Advocates for people with disabilities were in Tallahassee opposing Medicaid caps and cuts outlined in the proposed Federal American Health Care Act. Blaise Gainey reports on why they say the proposed cuts would impact Floridians.
At a Tuesday Tallahassee news conference, advocates for those with disabilities warned Florida would be hurt more than any other state in the nation under a $800 million in proposed cuts to the state and federal shared program known as Medicaid.
Florida has more persons with disabilities than most any other state, not only in terms of our 1 through, say, 64, but how about our aging baby boomer population as well?
With less federal assistance for Medicaid, the state would be left to come up with the necessary funds, with the legislature forced to make changes.
They're going to have to make some very tough decisions because the state of Florida will be receiving less federal assistance in terms of Medicaid dollars. So there's only 2 areas that they can look at cutting. One is beneficiary eligibility criteria, and the second is beneficiary services.
Those services that could be cut include assistive technology, items such as wheelchairs, power lifters, or even communication devices like the one Jennifer Perry Breen has been using since age 25 when she was given her own voice.
So this right here is something that Jennifer, when she came on the board, she didn't have a communication device. We attended a conference, the Assistive Technology Industry Conference. They set a device like this down to her, in front of her. It was the first time that she could talk, and then remember you said something like, this is good, or I have a voice.
Medicaid spending for people with disabilities is substantially higher than for those without disabilities due to their greater health needs.
That's her voice. And if she did not have a funding mechanism for this, or if other Floridians with disability didn't have a funding mechanism for this, their First Amendment right would be taken away.
Another portion of the proposed American Health Care Act of concern, advocates say, is the ability for states to get a waiver and allow insurance companies to deny people with pre-existing conditions.
This frightens me as a person with a pre-existing condition, because as a young man, as I was graduating from college, I didn't have a whole lot of choices. The employment perspective wasn't equal for me as it was for everybody else. And this was because of my pre-existing condition.
Florida's Agency for Persons with Disabilities administers Medicaid waivers to almost 34,000 individuals with developmental disabilities across Florida, while also providing limited services to over 20,000 people on the waiting list. For the Florida Channel, I'm Blaise Gainey.